So, just to kind of, this was just going over some of the problems that are probably prevalent and relevant to you. But now, just how do we avoid injury? Number one, understand your baseline. And what I mean by that is, do you have osteoporosis? Do you have spinal stenosis? Do you have any types of limitations with your bones or joints that you need to be aware of before you embark on some sort of exercise program or trying to stay healthy? So getting an expert review, someone like myself, to kind of take a look at everything and say, okay, I don't want you doing kickboxing or Thai fighting. That would be a really funny conversation, by the way. But then posture. Posture is it's this thing that, yeah, you see, I knew that was going to happen. I knew that was going to happen. And I'm going to mention that about a dozen times hereafter, and every time I say it, everybody's going to do that. But posture, it's one of those things that nobody really thinks about, but it is constantly weighing on you. And it's weighing on you because of gravity. And I have a slide I'll show you in a minute that's going to illustrate that better than anything. Bending and lifting, that's another thing. We just don't think about it. And some people relate, oh yeah, I need to lift better as far as the way I lift, only to things that weigh a lot. It couldn't be further from the truth. It has nothing to do with the weight of what you're picking up. It has everything to do with how you pick it up. You could herniate a disc just by picking up your car keys or a piece of paper or a brochure that fell on the ground, right? And so it's really not about how much weight you're picking up. It's about how you're picking it up. An exercise program. So after you've kind of figured some of these things out, then you can start getting on an exercise program that can put you on track to staying healthier and avoiding injury. Certain activity avoidance. If you're osteoporotic, wouldn't recommend horseback riding. Eventually something's going to fail, right? Once again, no Thai boxing. So, drugs. There are many drugs out there that can be used to assist with all these different things that I've talked about, all these different types of injuries or conditions. Osteoporosis specifically, we have a number of different drugs on the market now that can actually help increase bone density. The only problem with that is it doesn't happen overnight. It takes about a year. It's a pretty long time. So you have to be taking any one of these drugs for about a year before we start to see any change in your bone density at all. And so you can take an anti-inflammatory and it'll take care of maybe your arthritis pain or your tendonitis pain, but for osteoporosis, you got to be much more committed. There's one of the best drugs on the market. I have no conflict of interest with this drug, by the way, Forteo. I prescribe a ton of it, but it's a once-a-day injection. Yeah. And unless you're diabetic, you're not used to doing that. So it's hard to convince people that have never had to do that to start doing that. But that is one of the most beneficial things you could do if you're already at a certain point as far as your osteoporosis goes. And so Forteo is a metabolic type of drug that completely, it's like an exogenous hormone. So the fact that you're no longer producing as much estrogen, you kind of get on maybe estrogen replacement as well, but then this works kind of like parathyroid hormone, which helps to increase bone density. But once again, it's a commitment, injecting yourself once a day. Now, it's not as bad as it might sound. It's almost like you got a click pin, just put it on your thigh and pop. And it gives a little micro dose, and it's a very small needle. So I would encourage anyone that has osteoporosis to at least consider that. Now, the future is looking bright with biologics as far as stem cells, platelet-rich protein, and then other types of proteins that we can use that are going to help build tendon, muscle, and bone. So understanding your baseline, as I said before, female postmenopausal, get a bone density. Know where you are. If you have enough risk factors, insurance companies must authorize it. Now that brings up a whole nother can of worms, is getting any of these studies authorized. It's very dependent on if I document things accurately. Because if I don't, they're going to kick it back and say, well, what are her risk factors? Well, I've gotten pretty good at playing their game, and so if you put the right words on the paper, we can get it done and we can get it pushed through, and then we can get a baseline of where you are. Thyroid, are you hyperthyroid, hypothyroid, are you taking thyroid, and how's that going to impact? A good medication analysis. Are any of the medications that you're on actually putting you at more risk? Because that's one of the things that you would submit to the insurance company, making sure that these were documented risks. And then any other medical conditions, as I said, like rheumatoid arthritis, et cetera. So hormone replacement, fall prevention. Like I said, any of these treatments for the first year, I mean, it's a build, right? So you still have to be careful during that first year, extremely careful, because you're still at increased risk of a fracture during that first year until we start getting the density rebuilt. And then age-appropriate activity. Once again, no full contact ice hockey or anything like that. So start with an expert review. Someone like myself, figure out what you can and should be doing or should not be doing. And then what I like to encourage people to do, in this day and age, a lot of people have trainers. I'll go into that in a minute, but I prefer that someone starts out with someone that's a little bit more well-versed with pathology. You can know anatomy, you can know physiology, but if you don't understand pathology, the disease state, you can get into trouble. And so one thing that trainers are lacking is they don't have a full understanding of pathology. They don't understand spinal stenosis. They don't understand arthritic limitations of joints. And so they may be good rah-rah cheerleaders on the sidelines, but unless they truly understand what your personal limitations are, they may get you into trouble by saying, oh, come on, push through the pain. Let me tell you, if it's neuropathic pain from stenosis, you should not try to push through it. You need to let the pressure off, right? So I prefer that people start out with either a physical therapist or a chiropractor. Both of them are very knowledgeable as far as physiology, anatomy, and pathology. And then we do a diagnosis-specific kind of program thereafter. And then, if you really like your trainer and you want to get your trainer involved, or Pilates instructor involved, then have that person come in to a few of the sessions and learn. And they should always be open to learning. There it is again. Don't do this. We all do it. It's horrible. It's horrible. Every time you sit at the computer for more than 5 or 10 minutes, your head starts getting closer and closer to the screen. And it's reflexive. And one thing that I encourage people to do if you have a problem with something like this is get a digital timer. Keep it in the room with you, but put it across the room from you. All right? So when you sit down at your computer, kind of assess your posture, hold your head upright, but you have that digital timer on 15 minutes. And when that thing goes off, take note of what position you're in. I guarantee you're going to be like that. And so it's classical conditioning. We're just putting you in Skinner's box and just doing it again and again and again. And so you keep doing it until you start to feel the change as soon as your head goes forward. And then you're going to self-correct after a while. Now, this is a great illustration because it couldn't state it more clearly. For every inch forward that your head goes off axis, it's as if you're putting 10 more pounds of weight on your neck. That's a pretty impressive statistic. And so if you think about it, if you were to put, just even on your finger, if you were to put 10 pounds of weight down like that, it's pretty easy to support that. But the second I go off, it fades very quickly. Same amount of weight, you can't hold it up because all that stress and strain goes down the back side. So that's what's being transferred into your cervical musculature, right? And then on top of that, as you do this, you're going into further extension, although you're going chin forward, so it's as if you're putting more weight on your neck, so that's going to put more strain on the muscles and on the facets. You're also going into extension, which is actually closing down the neuroframe in the spinal canal. So if you even have a little bit of spinal stenosis, that position is going to make it worse. So spine biomechanics. We won't go into too much detail, but it's important that you understand it because this is what this all revolves around. You have vertical loading, right? The pressure coming from down and then it hits the disc. The disc is supposed to work as a shock absorber, and when it's working effectively, it's very good. But when it starts to break down, then you start to get bulging out the sides. One of the things that can break it down is if you have abnormal loads on it over a long period of time with bad posture. So when you're constantly having that chin forward posture, you're constantly having that slouching position, you are loading those discs much more than what they should be, and you're doing it over long periods of time. I mean, there's many people that work an 8-hour desk job, and they're in these bad positions for most of the day. We were not designed for that. We were designed to run from predators that were chasing us, right? Not sit at a desk for 8 hours a day. And also, they're sitting at a desk and they're getting stressed out, and the whole cardiovascular side of things is, that's a whole other thing. That is not a workout, by the way. Getting stressed out is not a good workout. So then here's another thing. Not only do we have the head and the chin posture, or the neck posture, the lumbar posture as well. And so keeping that in a neutral spine position while you're seated is very important, because the same biomechanics apply. The second you start to slouch, you increase the intradiscal pressure to one of the highest pressures it can possibly be. So imagine this scenario. You're sitting for 5, 6, 8 hours at a desk in this bad position. So that disc is preloaded throughout the whole day. Things are starting to fatigue. And then you drop your pen on the floor and you go boom, and you reach down really fast to pick it up. The disc herniates. You've already put it at a disadvantage throughout the entire day, and for the past 3 years that you've been working that same job. Now you just blew it out because you didn't pay attention to how you bent down. So I had to throw this one in. Good posture is the first step to balance. And per Kristen Louboutin, when a woman puts a heel on, she has a different posture, a different attitude. She really stands up and has a consciousness of her own body. So, per Christian, you should all wear high heels all the time, and that'll keep you in a better posture. I'm not sure if that really works, but... So I'll move on to bending and lifting. So proper lifting technique, we talked about it a little bit, but it's really all about keeping balance, bringing whatever you're picking up close to your body and bringing it up your body, using your knees to bend down. Don't stoop and bend like this, right? Like over on the far right. There's also tripod lifting. This is a great technique where you just bend down like this, one knee, and you can pick whatever it is up. Even if it's 100 pounds, you can bring it close to you and then bring it up like that. Or if it's your keys, you just bring your and another thing is you can always brace yourself on a table or a chair to pick things up. Anything to kind of offload your torso is going to be helpful. This is not good either, picking up, and as the dog's running away from you. I can't imagine a worse possible scenario of things about to go awry. The dog's running away from you as you're trying to grab it, and you're stretching and reaching, and it's only a 10-pound dog. Some would say that this is the best way to lift, have somebody else do it. And and in some cases, that's exactly what you should have happen. Of course, it's going to be kind of hard to have somebody pick up your keys every time. That'd be... So exercise, it improves your mood, reduces stress, makes you feel satisfied, improves self-esteem, improves body image, a sense of energy that you don't normally get. You usually get better sleep, improve confidence, confidence, and decreases depression. So you can also get injured doing exercise, and so these are the things to... This is horrible. I'm like telling you what not to do, but then also telling you to do something, and you'll hurt yourself anyway. But no, as long as you're cognizant of it, as long as you know what things to be aware of as you're doing these things, once again, it's very manageable. But cardio, you can get tendonitis sometimes and bursitis. The ways to avoid this is to build up to it. Whatever you were doing 10 years ago, you're not going to be able to go out and do it 100% tomorrow. So you have to build back up to it. You have to go ahead and kind of train to get to the level that you want to get. So if you used to walk 5 miles 10 years ago, just start by going around the block once, honestly, and then slowly build up, and you'll get back to that 5 miles again, but don't try to do it right out of the gates, because you're asking for trouble, specifically in the fashion of tendonitis or bursitis, when you try to push too hard, too soon, too fast. Weightlifting, tendon ruptures, tendonitis, once again, Tendon ruptures will usually only happen when you already have a tendonitis ongoing that's been kind of a chronic type of issue. Yoga. Yoga can be great, but for certain diagnoses, you have to just modify it and avoid certain types of poses. Hyperextension specifically for anybody that has a spinal condition. Pilates, certain types of Pilates moves as far as flexion. Swimming is one of the greatest things as long as you can swim. I guess, yeah. Drowning is the biggest risk factor, I suppose. Yeah, I can just see that in the paper. Dr. Davis said no. So another thing, sport type of exercise. So tennis, golf, running, cycling. I put gardening in there because it's an activity. And I mean, if you're doing it long enough, you're working your forearms, you're bending down. And if you're not doing it correctly, it can really lead to neck and back problems. But with tennis and golf and running and cycling, once again, it's kind of building up to endurance, to levels of endurance. And if you go back to your younger days where maybe you were playing high school athletics or college athletics, you trained all the time. And somewhere in your late 20s and early 30s, it all kind of went away. We're no longer training, but we expect we can go out and play 18 holes and everything should be fine. You need to keep yourself in shape in order to actually tolerate those activities. All right, so you should sit this one out. The reason I say that is because when you're in yoga, you should sit this one out maybe. The cobra is, it really closes down the spinal canal, all right? And if you have any degree of facet arthritis or spinal stenosis, this will aggravate it. And I hate to see that when people are active and they're doing great, but then they try something a little new. And I mean, they could be cycling 20 miles a day and doing all sorts of stuff, and they go, oh yeah, I'm going to try yoga. They get in their class, they're healthy, they're active, they're athletic, and then they do this, and they're down for the count. And it's because it's a completely different movement for them. They haven't had any experience with it, and it's because there's a certain pathology lurking underneath that predisposes them to a problem in getting in this position. Maybe you should sit this one out too.
No intention.
Yeah, either one of those. Those are a little aggressive. Or you could have a psychological injury doing yoga next to this guy. So Pilates. I really do like Pilates because a lot of what Pilates is a neutral spine stabilization. But there are certain things that you can get into, certain positions you can get into, where if you have any kind of disc issues or things like this, or look, if this person had a neck issue, the amount of load that is going on to the cervical thoracic junction right there is huge. And so I would really have to clear somebody before they would even try that. Otherwise, what? You still trying to figure out what position she's in? Yeah, it does look like that. And maybe you should sit this one out too. So active stretching is good, but passive stretching can be bad. And the reason I put this up there, this is a very offensive picture, by the way, but the reason I put this up there is anybody that's been in a yoga class has had the yoga instructor go around and put his hands on your shoulder and, oh, stretch, breathe. And he has no idea what's going on in your body. He has no idea what you can and cannot tolerate. And so don't be afraid. Don't be afraid to tell this guy to get the hell away from you. You probably wouldn't be afraid, but usually it's not that extreme. But that passive stretching can sometimes be the thing that pushes you. I'm going to get that one off the screen now. But that passive stretching can sometimes be that thing that just pushes you over the edge. Now, this is an imminent fail, as you can see from the bottom. We're moving on to personal trainers now. And look, there can be some great personal trainers. And the best personal trainers are the ones that continually educate themselves. The best personal trainers are the ones that actually try to integrate themselves into your healthcare team. And just to let you know, the people that are sometimes giving you instruction, oftentimes they have a high school diploma. That's about it. They have on-the-job training. They may or may not have a certification. Some organizations now require a college degree, but that doesn't translate into understanding pathology. And I'll go back to that word pathology. They may understand anatomy. They may have done a lot of reading on anatomy and physiology, but that does not mean they understand what's going on in your body from a pathologic standpoint of, let's say, stenosis or arthritic joints. And so I've seen this in the gym. I've seen this all around where, you know, somebody is signed up for this P90X type stuff, and I can't count the number of people I've seen get injured from that because they've been athletic, they've done certain exercises, but then they say, oh, I've heard people have lost a lot of weight and gotten in good shape doing this, but it's so aggressive, so fast, that it's just not a good idea. And sometimes I'll see trainers putting people in this weird contortion positions and then putting a weight in their hand, and I'm like, what in the hell is going on? And this is a classic example. Is who in their right mind would do that? It's bound to fail. But that's what happens. All right, so this is an actual story of a patient, Brenda, age 51. She had her first session with a trainer, and she was instructed to do jumping jacks while holding a medicine ball over her head. Anybody have any ideas of how that's going to end? Her hands got sweaty, the ball slipped out of her hand, landed on her head, and she got a compression fracture. Now, didn't get a spinal cord injury, but, you know, once again, it's be smart. That's just not a good idea, and especially the first time out. There are these whole programs built around like medicine ball workouts and kettlebell workouts and things like that, and you have to please always question who's giving you instruction. All right? Because they may not know more than you. You may know a lot more than they do, and you definitely know your body more than they do. And so if it starts to hurt, sit it out, right? If you're in that yoga class and you go, well, that kind of twinges, I'm going to back off on that one. I'll keep doing everything else, and if they come and try to push you, just, once again, tell them to back up. Don't be afraid to say no, because you're going to protect yourself more than that person is. So avoidance. If it hurts, don't do it. That is a very, very simple equation and a simple solution, at least for a little while, right? At least let us figure out what's going on, get it cooled off, then get you back in action. But taking a break from whatever activity it is that keeps on coming up is probably one of the best ideas you can do. I have a lot of runners that come in and they'll have plantar fasciitis, and they go, every time I run, it hurts. Like, of course. And the most they do is like take a week off, and I'm like, this is a little bit of a longer process than that. But it's, you know, modify that activity, whatever it is that is causing the problem, modify that activity. It doesn't mean you'll never be able to do it again. It just means that you have to really focus in on where the pain's coming from, what caused it. And the most common thing with those runners is these are people that are really used to running, like running marathons, half marathons, things like that. And what will inevitably happen is something will come up in life. They won't have run for 2 or 3 weeks, 4 weeks, and then boom, they go out and they try to run 15 miles. And then that's when it comes. That's exactly when it comes. And then once it comes, it sticks around. So medications can assist. I mean, I have a lot of people that are golfers, avid golfers and tennis players. And with, as I said, arthritic changes, chronic arthritis, sometimes it just is what it is. And if you have to take a Celebrex or an ibuprofen or an Advil preemptively before you go play your game, who cares? It's fine. There may not be a better answer than just prophylactically taking an anti-inflammatory before you go play. As long as you're not getting some sort of residual symptoms that drag on through the day, into the night, into the next day, then it's pretty self-limited. And starting with mild range of motion. When there is an injury, start back mildly and then train to play. Then just remember that, like I said, we used to train so much when we were younger for whatever athletic endeavor we wanted to do, and then somewhere in our late 20s and 30s we lost that. But it's time to get back into that. It's time to remember that if you do want to go out and play golf a couple times a week, you're going to have to do something else on top of that to keep yourself in shape.